Sort of DHS demo version 2 video series. So in this episode, actually, we are going to take what can I call it, word actually. And then in case of you having watched the previous episode, I will strongly advise you to go back and view the previous episodes, especially the clinic ward, the clinic doctors and the clinic nurses. And without further delay, actually, I will just go ahead and click on the word, and I will just focus on the private ward 4, because in the previous episodes we have admitted a patient there, so we can just quickly go and see what will happen or what is obtainable in the ward. For your information, most of the things that is available in the clinic actually are also available in the ward. There are no much differences. The only difference is in terms of doctor can be able to make consultations and also admit in the clinic, but in the ward the only difference, doctor cannot admit in the ward because doctors is attending to admitted patients, and the only thing that is not available in the clinic in the clinic but is available in the ward for doctors is actually discharge. Doctors can discharge patients in the ward but cannot discharge patients in the clinic, while for the nurses everything is the same except 2 additional functions. Actually, there is nursing shift report or hands-over report, and also there is medications activities that is supposed to be available in patient care that is not available in the clinic, because the patients that are seen in the clinic are actually outpatients. So let me just quickly attend to this. As you can see, we have the list of patients that are available in this ward. We have the hospital ID, full name, gender, age, HMO, date admitted, day spent, beds, and of course the actions menu contains the actions buttons, and then the actions buttons may differ based on your privilege and also based on the state conditions of the patients. So without wasting more time, actually I will just go ahead and click on the actions button, on the bed actions button. As you can see, I can see this menu. So the menu is somehow looking the same compared to what is obtainable in the clinic, and even the content except transfusion, ICU, daily assessment, medications, and discharge that are not available in the clinic, as I said earlier. So taking vital or nursing report or consultations review or referral is the same thing with what is obtainable in the clinic, so I will not waste my time going through this. So if you have any issue with this, please kindly go to the previous episode of the video. You will see how we attend to those area. So I will start with the doctor. Actually, if the doctor is in need of maybe during ward round need to make some documentation, actually the doctor can come to these sections and clicking on consultations or review, and he will get access to this what can I call the consultations dashboard. Or maybe during the since it's a ward round, the doctor may not be required maybe to put the detailed information, but rather will just put his or her own review. So you can use the review template and write whatever they want to write. If they need to prescribe drug, is here, just like we did in the clinic, or lab for laboratory investigation, or RAD for any imaging investigations, or any surgery or procedure or blood request, or any other activities such as discharging the patients or referring the patients to another facility or to another clinic. That's all for the doctor, except discharging the patient, which we are going to take it after we consider nurses activities in the ward. And part of the nursing activities in the ward, as I said earlier, is providing a hands-over report. Ideally, after any shift during switching, the one that is taking over is expected to have a handover written by the one that is leaving. So in order to do that, to write a report, all you need to do is to click on this nursing shift report, and you will have a field like this. You can type your report this way and click on submit. So once you submit, any person that is taking over, when he come and click on that the same box, he will see the last report submitted by you, so that he will be guided on the situations in that very word that is he is taking over or she is taking over. That is for the shift report. The next thing in the clinic for nurses, I think, is medications. For the medications, you may have something like this: drug chart, observation chart, feeding chart, or fluid balance. So you see, as we can see, we have drug chart. For the drug chart, actually, normally the nurses use to monitor patients' medication in the ward. So in order to monitor patient medications, you need to know what was prescribed by to the patients by the doctor, and also use that very prescriptions and chart it so that in an appropriate template, so that for you to use, or any of your colleague to use during medications time and all medications hour. And also we do have extra medications, indicating that in case of if you serve any medication that were not prescribed by the doctor, or because of one reason or the other, so you need to also document that in the extra medication. So as you can see, if we have any pending prescriptions for this patient, we will see it as I click this checkbox, but so far there are none. And let me just go to the active medications. So as you can see, in the active medications, we have this content, this table. So as you can see, the first two item in the table is augmentin 625 mg and tabdaclopenic. So all of the two items actually are colored green, not just green balls. As you can see by status, it shows SAP, which means this medication are due today, and the nurse actually serve the medication, or not just serve, also document it. So if in case the medication is not being served, the color will be, the boldness will be the fonts there will not be that bold, will be tiny. And also, maybe in case if the day fast and the medication is not indicated as SAF, then the color will be red. And the one you see with black color actually are the medication that's supposed to be taken the subsequent days. Or maybe the medication, you may see the color brown. So if you see anything with the color brown, then the medication actually has been stopped by the doctor at a particular point. So assume that as you can see, the first two item actually is just the first dose that has been served. Maybe probably I want to serve the second dose. I'm the one taking over now. I can click the item that I want to indicate I serve the second dose. I will click the second dose dosage, and then I will indicate the kind of dosage I serve to the patient, like 625 mg. So I will click on the serve, and I can click on this back to go back, or as a doctor, if I'm a doctor, I can click on stop to stop the medication in case if there is need for that. So as I go back, as you can see right now, the second shot for the first drugs shows under the dosage as 625 mg, but the second drug, as you can see, the dosage column is empty. So if I want to also indicate that I serve, I will just click on that action button, and I will indicate that I have served the last dose, which is 1g. I think no, the second dose actually I will put 1g, and click on serve, and I can click on go back. So I'm expecting to take me. So as you can see, the second dose is not longer blank, indicating serve. So that's for the active medication. And for extra medication, I have already explained, give down the descriptions of the drug that you have administered that has not been prescribed by the doctor, the time that you have administered it to the patient, and your justification, and click on add. So after that, the next thing is observation chart. Observation chart, doctor may maybe give an instructions that maybe the patient's BP or patient force or any other things in the list that should be taken on hourly basis on so occurrence, things like that. You will get the instructions here under this observation chart. Then all you need to do is to specify the information on that very hour as instructed by the doctor and be clicking on add. The system will create a tabular presentations of that observations you are making, and of course will also create the graphical image for the doctor to be able to know the state conditions of that very patients and be able to take decisions. And the next thing is feeding chart. In case the patient requires assistance in terms of feeding, so all you need to do is to give the descriptions of food you serve to the patient in this column. Then next thing, through what means the route, is it oral or NG tube, things like that you can indicate, and of course the volume you have served to the patients and your remark and the time taken you can add. It will also generate a tabular form, tabular view of your entries or your input. And also lastly, the fluid balance. Actually, as you can see, doctor may say you can administer maybe like let's say normal saline, and in unit maybe the unit should be mils, let's say 500 mils. Let's say 500 mils. Let's say are targeting, let's say in 8 hours, and to be administered through IV as an IV. So I just click on the add as an instruction. So when I come as a nurse, I will see the instructions here. As you can see, normal saline 500 milligram to be administered in 8 hours. So when I click on this, I will have this field populated. So I will indicate the total volume so far I serve the patient. Let's say I assume I serve 100. I will indicate 100. If in case maybe vomit can maybe remove some quantity from what I have administered, I can estimate the volume of the quantity lost in the vomit. Let's say like 10. If can also goes out through urine, I can indicate, let's say like 8. And then maybe if there is any other reason that lead to the loss some quantity, maybe through cannulation or things like that, while I'm preparing to start the infusion to the transfusions to the patients, maybe I may lose some quantity. So I will also, if there is such, I can indicate, like for instance, as you can see, I put 5, indicating that I have administered 100 mils. I lose 10 through vomit, lose 8 through urine, and lose 5 any other reason. So if you can add up, we may end up having 23 that were lose out of 100 mils administered. So let me just click on add and see the result. So as I am click on add, this is what we have. We have normal saline route IV total 100 milligram, total vomit out 10, total urine out 8, total others out 5, and then this is the time and the date and the one that is administer the flute. So and so far, this is the vital information we are seeing down here. The target volume to be administered 500, total administered so far 100, total vomit 10, total urine 8, total others reason 5, and then the balance is 423. If you can remember, I said we have lose 8, 5, and 10 through vomit, urine, and other reasons. So if you add up 8, 5, and 10, you end up having 23. And if you could remember, you administer 100. So instead of you to have 400, because 500 minus 100 is 400, but because you have lose some quantity from the main 100, from the target 100 that you have administered, so the system is asking for that, because ideally it's not part of what you have administered, so it needs to be replaced. So that's why the system put the 400 and 23, the one you lose. So basically that is a fluid balance, and that's for medications. So if there is anything that I want to talk about in the word, most especially something that has to do with nurses, is this actions buttons. So this actions button would wheelchair in word actually indicating transfer. In case maybe you want to transfer this patient from one to another, or from one bed to another, you can transfer patient to another ward, or from another bed to another bed. So all you need to do is to click on that very button. It will take you to the transfer dashboard. It will allow you to select the ward in case if it is not bed transfer. So you can select the ward, and if there is any bed available, it will be showing you transfer the patient. You will see the patient will disappear in that very ward you are seeing it. But when you go to the ward you have transferred the patient, you will see the patients there. So that's for the transfer. And then the next thing, maybe during consultation or during review, things like that, the doctor may need to see the history of this patient. So you can click on history. There are different points where you can access the patient history, either by using this actions menu in the ward or in the clinic, or maybe you can even search the patient. If you have that very privilege, you will be able to see the history buttons, and you can click on the history button to be able to see the patient history. So as you can see, we have the basic patient informations here, and the most recent diagnosis of the patients and the admission status. As you can see, the system shows the patient is on admission, and of course is on admission. And the next thing is to select the template where you want to query, because patient profile history is a very wide thing. So one may be interested on knowing the vital information, one may be interested in knowing the previous consultation done, or nursing report, or admission, or prescription, or transmission, or medications, things like that. So whatever you are in need for, you can click on that very item. Or if you want to query everything, you can leave it this way as all aspect and click on this slot. So the system will try to load everything that's been documented for these patients, as you can see, the laboratories, investigations, and other things like that. So after that, maybe the doctor may decide to maybe discharge the patients because the condition is being improved, or maybe the patient dead, so the doctor need to discharge the patient. So in this actions menu, you will see discharge, and when you click on discharge, the system will take you to this form. And in this form, you need to indicate the reason for the discharge. Is the patient recover, death, referral, DAMA, LAMA, or COP release? In case of DAMA or LAMA, I think there is a medical legal document that need to be signed by both of the party, that is the hospital representative and the patient representative. And after that, after indicating the reason, you need to maybe if you have something to comment, you can put your comment. And of course, you need to confirm the provisional diagnosis of the patients. If secondary one are available, you need to indicate the secondary diagnosis as well. And if there are such medical legal documents such as LAMA form signed by the patient or patient relative, so you need to indicate the title of that very document and upload it so that it will be part of the patient history. If there is any legal case or any other things, I think having such information intact in the patient profile will be of great importance. And lastly, in this form, if you want to ask the patients maybe to come for a follow-up visit, maybe after 2 weeks or more, you can select the clinic and the date you want the patients to come for the follow-up. And after that, you can click on discharge. I may write blah blah like this. I like maybe malaria, and I don't need to maybe appoint the patient to any clinic. I can click on submit. So with this, you see the name of the patient in the clinic the color is being changed from black to red, indicating that doctor has cleared this very patient for discharge. But nurses need to do one or two things, because sometimes in some hospital used to issue some item or properties to the patients, one that is expected after discharge, patient are supposed to return those properties. Not just that, some of the patients may be attend maybe based on credit or based on the arrangement. Maybe there are some money that he need to be settled. I mean, there are some balance of medical bill that he need to be settled. So in such cases, nurses are supposed to make sure that before patient leave the ward, the patient make necessary payments. So in order to before you clear the patient, you need to click on this red check box, and once you click, the system will take you to this page. As you can see, the reason for discharge is recovered, discharge date this day, discharge by the name of the doctor that discharged the patient, number of days the patient spent, and cost of bed space is 0.00 and wallet balance 0.00. so if you see any rate in this case, advisably you need to click on this send bill to the finance and ask the patient or patient relative to go to the finance and settle the patient bill. But as you can see right now, because the patient has not spent yet a day, even if they go there, there are nothing to be billed, so you will not see any bill there. But keep in mind that if there is any bill and you have go ahead, you have cleared the patients, the hospital will hold you responsible that you have released the patients that have some pending financial issue with the hospital. So things like that. I think with this, that's all we have for both doctors and nurses in the clinic. And if you have any questions, observations, or contributions, you can make such to you can mail us through info.ipsoncar@gmail.com, and also you can also leave a comment under this video comment sections, or you can chat us via our WhatsApp line that is attached to this very channel.